How does post-exertional malaise define CFS-ME diagnosis? Imagine feeling perfectly fine one moment, then suddenly experiencing a wave of worsening symptoms after even the slightest activity. That's what post-exertional malaise is all about. It is a key feature in diagnosing chronic fatigue syndrome and myalgic encephalomyelitis. Post-exertional malaise refers to a significant worsening of symptoms following physical, mental, or emotional effort that previously wouldn't have caused any trouble. The interesting part is that this worsening can be delayed by hours or even days after the activity and can last 4 days, weeks, or sometimes longer. This prolonged response often leads to a relapse or a big drop in daily functioning. In fact, medical guidelines for diagnosing CFS or ME consider post-exertional malaise essential. For example, the 2015 Institute of Medicine criteria requiring the presence of PEM along with a substantial reduction in activity and unrefreshing sleep. The description emphasizes that exertion triggers a profound flare-up of symptoms that is not relieved by rest and often feels much worse than normal tiredness. The international consensus criteria also highlight a similar concept called post-exertional neuroimmune exhaustion. This term describes rapid and marked physical and mental fatigue after minimal exertion, with recovery taking a long time and symptoms like flu-like feelings and pain worsening. Other diagnostic frameworks agree that post-exertional malaise is a core symptom because it shows an abnormal response to exertion. Unlike fatigue caused by overdoing it or other medical issues, PEM is disproportionate and often triggers relapse or significant impairment. When doctors diagnose CFS or ME, they look for this pattern of delayed symptom worsening, especially when combined with other common symptoms like unrefreshing sleep, cognitive difficulties, and orthostatic intolerance. Usually, symptoms need to persist for at least 6 months, and other causes must be ruled out first. In clinical practice, doctors carefully ask patients about PEM because many may not initially realize that their symptoms worsen hours or days after activity. Recognizing PEM is crucial because it guides diagnosis and helps prevent treatments that could make symptoms worse, such as pushing through fatigue with exercise. Understanding this pattern helps distinguish CFS or ME from other illnesses that cause fatigue but don't have the same delayed and prolonged response to exertion. Overall, post-exertional malaise is a defining feature because it captures the unique and often debilitating pattern of symptom flare-ups after exertion that is characteristic of this illness. It highlights how CFS and ME are more than just fatigue. They involve a complex and abnormal response to activity that can severely impact quality of life. If you or someone you know experiences these symptoms, it's important to consult a healthcare professional for proper assessment and support.